Welcome. This is the Health and Wellness Coach Journal podcast. I'm your host, Dr. Jessica Singh, the founder and CEO of the Center for Health and Wellness Coaches. This is a podcast for coaches to explore topics related to health, wellness, and coaching, sharing knowledge and sharing light. Dr. Michael Baran is a social scientist and CEO of Exclusion. Through his speaking engagements, writings, consulting, leadership development, workshop facilitation, and digital products, he and his diverse team help organizations build cultures of inclusion, psychological safety, innovation, and performance. Before making the shift to full-time consulting work, he taught courses at Harvard University and the University of Michigan, and he worked as an applied researcher at the Frameworks Institute and the American Institutes of Research. His work has been covered in the New York Times, Forbes, CNN, NPR, and more. His book, Subtle Acts of Exclusion: How to Understand, Identify, and Stop Microaggressions, was co-authored with Dr. Tiffany Jana, with the second edition released in 2023. This book has won several awards, has been a Hudson News and Amazon bestseller, and has been named by Forbes as one of the 11 books to read to be a more inclusive leader. His podcast, The Culture Advantage, was launched in August of 2025. Welcome, Michael.
Thank you, Jessica. Really happy to be here.
It's such a pleasure to have this opportunity to speak and learn from you.
Thank you.
I'd love to know what key factors shaped your journey into the field of diversity, equity, and inclusion.
Yeah, so I grew up in a really homogenous town, not very woke family, you might say. So I didn't grow up thinking about much in terms of diversity, equity, and inclusion. I mean, a little bit. I felt a little bit that sense of being an outsider just from being Jewish in a small town where there were not many Jewish people. But then going away to college and getting to know a diverse group of people, I started getting passionate about the inequities that I was hearing about, the exclusions I was seeing. And it sparked this whole curiosity as well as drive to do something about it. The curiosity led me to eventually getting a doctorate in cultural anthropology with a bit of cognitive psychology because I needed to understand why this all felt so wrong and illogical. I needed to understand why this was still happening so pervasively in our society, in our world. And so once I figured that out for myself by doing research for 8 years, then I felt like I could actually work with organizations and help them both do things that worked to improve their cultures, but also to help explain to people why things work the way they do. A lot of times we get solutions thrown at us and they don't fully make sense because we don't understand why the problem works the way it does. When we understand that, the solutions make a whole lot more sense and we can actually get more buy-in and commitment.
Thank you so much. And for anyone listening, highly recommend reading Dr. Baran's book with Dr. Jana. One of the things I loved in the book that you had also explained about your journey was how you took yourself out of a familiar environment to then learn more. I was wondering if you could just elaborate on how that was for you. I found that very touching.
Yeah. You're talking about fieldwork in Brazil?
Yes.
It's one of the cornerstones of getting a doctorate in cultural anthropology. It usually happens. Sometimes people do fieldwork in cultures they're really familiar with, but most of the time it involves going to a culture that you really don't know about, that you're not familiar about. You know about it from reading and all of that, but it's not your sort of home culture. And you don't just do research for a week or two, parachute in, parachute out. So I was curious about how people of all different ages, children included, learn about race and identity and how exclusion or inclusion plays out. But I wanted to do that in this particular area of Brazil. So I went and lived there for 2 years, where at first Things are very unfamiliar, and you have to make a fool of yourself again and again in many different ways until the culture and the place and the people, it starts to feel more like home to you. It starts to feel like a home culture almost by the end of 2 years. And then you go back home and you think you're going back to what you know and what's comfortable. Often that's where the real culture shock is. It's not when you get to the other place, it's when you're coming back home and you don't expect to be shocked. So the whole idea of that is really taking something like culture, which can be very hard to see. People talk about it as like water to a fish. You live in it and it's hard to really see it because it's such a part of everything. And so that takes it and makes it something you can more objectively look at and think about and analyze and think about where it's going wrong and what we could do about it differently. So that whole process, I wish everyone could do that at some point because it feels so mind expanding, mind growing, empathy building, understanding about the world growing. Like it's just such a formative experience, I think.
Can hear the warmth in your voice as you're talking about that
Yeah.
experience, just very soothing.
Yeah, I loved the place where I ended up. It was just amazing people and an amazing community and wonderful friends and experiences to this day.
From all of that work, how did you find applying and integrating that work now into the work you do in Iris Inclusion? If you'd like to share a little bit more about it, because to be very honest with you, before I read this book, when I think, just with my limited experience in medicine, about a corporate environment, sometimes, the patient interactions or when you're actually doing what you love, that warmth fulfillment comes out. But the other side of the corporate environment doesn't exactly bring out the warm and fuzzy part. And so
Yeah.
I'm curious as to how you were able to do that and how you do the work you do.
Yeah, that's such a great question. I mean, it comes through in so many different ways and sometimes not directly, right? It's sort of like this foundation that got built in my brain for being able to see cultures in a different way and what's at play, sometimes in very subtle ways when we talk about people feeling included or excluded. Also, for being able to see systems in a different way and how they impact people's experiences and the outcomes of any society or organization. Also, being able to figure out how to study and talk about cultures. Right. So that's some of the work that we do that might be a place that we start with organizations if they are willing to do it, which is, let's say an organization or a leader has a sense that, hey, maybe there's something going on here that's not perfect. I just don't know what that is. I don't know where we're going wrong or how we're going wrong. And so we might be able to go in and do a mix of different research methods and maybe a quantitative survey to really see how people are feeling, whether they're feeling inclusion and psychological safety and belonging, or then maybe some focus groups to go deeper on that, maybe some interviews to understand how processes happen, how practices really happen. Because we've got policies and we can look at those, but what really happens is a different story. So, really being able to go in and with a limited amount of time, do some research, basically mixed method social science research, to be able to then understand what's going on with a culture. And then that becomes the roadmap for what we end up doing as interventions or trainings or bias blocking procedures or whatever we end up doing. We're not just doing a cookie cutter kind of playbook for every organization because every organization is different. And there's some things that they're doing that don't need changing because they're doing them wonderfully. But we have to know that in order to really do that culture change work.
And it just struck me just as so powerful, the culture change work and how you're able to identify and also teach to raise awareness on subtle acts of exclusion or how you
Yeah.
reframe microaggressions. And so, for those who have not yet read your book, would you mind summarizing just what subtle acts of exclusion is about?
Yeah, of course. So, probably most people have heard the term microaggressions. That term has been around since the early 1970s based on the work of Chester Pierce. Thankfully, he brought attention to a lot of discrimination that was happening and not getting the attention that it deserved. We know from a lot of other research about the frequency with which microaggressions were happening, the impacts to people, to teams, to organizations, and to define microaggressions. I sometimes think of it as those times when there's a disconnect between the intent of someone and the impact that it has for someone else. So, someone might be trying to be funny or to connect with someone or to bond with someone or compliment or help. That might be the intention, and yet it lands in exactly the opposite way: hurt, pain, exclusion, or stress. Sometimes that's a good definition of microaggressions. Sometimes they're also not so well intentioned, and that's a different story. But what led to the reframing was finding that these were happening so frequently, especially to people in certain groups, that they were causing mental and physical health problems. That's how significant this was, and happening all the time. And we weren't making progress on it. And so when organizations would have us in to do a workshop on microaggressions, we found that they were really frustrating workshops, that often we couldn't even get past the word to actually talk about the work we are trying to do. The work being having people share what they're experiencing and how it affects them, and other people listening and hearing that and creating a different kind of environment or culture. But we couldn't even get there because we'd give an example of a microaggression and people might think, that's not aggressive. I was trying to give a compliment. You can't call it a microaggression. And they would get very defensive. Or they might focus on that micro part of that word, which people tend to think means small or unimportant. And then if that's happening to you, that feels bad. Or if we're asking you to come to a workshop and we're implicitly signaling that this is something not important, how likely are you to really take it seriously, to think about changing your behavior, to not be super frustrated? You have to sit through that workshop when you have things considered very important waiting for you at your desk. So for a while, there was this sort of grumbling under our breaths. We need a new word for this thing. And then Doc Jana was like, hey, I'm finding the same thing. Why don't we be the ones to think of a new word for this? And that led to us brainstorming a long list of possible reframes. And that's what led to eventually us thinking, let's just call these things what they are. Let's not try to be clever about it. Let's just call them what they are. And that's what led to subtle acts of exclusion. And just reframing it like that helps people understand very quickly what these things are a little bit better, as well as what's at stake, right? What the problem is. It's a different on ramp to the same problem, and it helps us get a very different result, which is more buy in, more people seeing this as a problem, more listening to other people, a framework for being able to share about what you're experiencing and actually be heard about it, some guidelines for speaking up, being able to really take this from something flying under the radar that doesn't get attention and can't be addressed because people don't know how to actually creating a whole framework where we decide collectively at an organization, we're not going to let this happen here. It might happen out there. We're not going to let it happen here. And we're going to be in that together. And so then when someone shares, it's not just an accusation, but it's an opportunity to put that into practice. And it can feel good instead of bad.
You make it sound so easy.
It's so easy.
It's amazing that you
Uh,
guys are both able to obviously, so much of this insight that you've gained with Doc Jana has been through your own firsthand experience and all this education. And it's wonderful that you figured out how to measure and assess organization culture to demonstrate change. I think as a coach, as a consultant, as a scientist, you talked about buy in. It must be difficult to quantify when a culture is so much like this, but it's so hard to have the direct correlation as to maybe this is why there's turnover or why mistakes are happening, because it's not like X event might have led to it, and maybe it did. It's accumulation of that. And so the
yeah.
fact that you have been able to figure out how to communicate that with organizations is so inspirational.
Oh, thank you. It's so illuminating for them sometimes. They'll look at numbers of people leaving the organization and scratch their heads like, why are more people of color leaving? Like, what are we doing? We're so nice and we're so welcoming, we think. And so, what is it about what's happening there, whether through policies or culture, that is making people not feel those wonderful feelings to the same degree?
And the other part is I'm just using medicine as my baseline is when you are that frontline worker and there's the culture is what it is and there's this feeling that in order for anything to change, it has to be top down. And
Mm,
so in the book when you talked about how just at any level everyone is leader of the people that they're working with regardless of their former leadership title. And
yeah.
so then to give the hope that maybe you can affect change even if it's not from the top down. Really
Yeah.
powerful.
Oh, absolutely. Everyone has the power to put that into practice right away. Obviously, leaders and people managers have an extra responsibility and an extra impact because of what they do at the organization, but everyone can do that. And in the field of medicine, this is not just the dynamic which impacts how we all work together as a team of providing care, but also impacts what kind of safety and inclusion are we creating for the people we care for, which can have direct impacts on their health outcomes, right? Which is what we care about. And you often don't think about that. Like those feelings of inclusion in those situations, they impact health outcomes. In schools, that feeling of inclusion impacts learning outcomes. Like it's not just nice because it's nice, it's also makes a difference in our explicit goals.
Which makes so much sense, even
Mhm.
just from psychological safety, feeling safe to learn, and
Yeah.
optimizing potential.
Yeah, for sure.
How have you seen the challenges you described when you were using microaggressions before it changed to subtle acts of exclusion?
Yeah.
I could still imagine that the first time this talk is given still might be heated with people sharing really what they've experienced that's hard to share. How do you find that it's been to shift, to actually raise awareness of this enough to shift the culture? And I'm so inspired to see what that must have been like for you.
Yeah, it's beautiful. Like when I first started giving talks using this language and this framework, even before the book was out, the difference in the workshops or in the talks is palpable. Like you can see the relief, the tears on people's faces when they're hearing, wait a minute, I might be able to talk about this in a way that it's heard. That's incredible. Or other people thinking, gosh, everything's so sensitive these days. I want to be better, but I don't know how. And seeing those people realize what might be happening and realize it's not about getting everything perfect. We're all going to mess up sometimes. So, in many ways, it's a relaxing. It doesn't have to be a record scratch when you say something that you just didn't know that would make someone feel bad. You can hear them tell you that. And by the way you respond, you can create more trust if you respond well. Like that's a relief for people too. And so seeing that happen, the excitement and the energy, I had never seen that kind of excitement and energy with audiences or with groups we were working with before in any of the other topics that I had done talks or workshops on. It was really exciting. And we learned so much from those early talks and how we put it into practice. But we knew that's one reason why we knew we were really onto something with this.
I can't even imagine how fulfilling it must have been, and it must be to do this.
Yeah, sometimes there's still people who are not really open to hearing about this and still approach the whole topic with defensiveness. And that ebbs and flows. Maybe is a little bit stronger right now, where people just are not open to hearing about it and feel more emboldened to take that stance publicly.
Especially, like, with politics the way they are and then changes in funding.
Yes, that creates a different kind of environment.
Yeah, which is why the work is so well needed.
Yeah, it's needed maybe more than ever. And yet there's a lot of uncertainty with how to proceed because people, leaders, can be scared about what the repercussions are going to be if they engage in certain kinds of work. They might not feel like they found their feet yet with what do we call this work? If we're not calling it DEI, which has become a polarizing, toxic, unproductive term. It's been made to be that. So it's not helpful now to communicate about anything because people might not know what it means, but they know they're against it, right? Because it's become a term that is not helpful anymore. So if we're not calling it that, then what are we going to call it and how are we going to build it into what we're doing? There's just a lot of uncertainty around all of that.
For sure. I know that a lot of thought will go into it, but it just as how you guys brainstorm to call it what it is, the subtle acts of exclusion. It's like shifting workplace cultures or creating cultures of inclusion.
Yeah, I've stopped using the acronym as many people have, but I will just say the words straight up. If we're talking about a diversity of people, we can be really clear about what that is. If we're talking about feelings of inclusion, we can talk about that. If we're talking about trying to make sure there's equity for everyone, we can talk about that. We can use the words straightforwardly and clearly. And then if people are going to disagree with that, then they can tell me about how they're really for homogeneity and inequity and exclusion, which I don't think people really want.
I'd hope not.
Yeah.
It's a different world we're in.
Yes, the majority of people. And there's research showing that when you talk about the specifics of the work that has fallen under the umbrella of DEI, you get widespread support. When you call it DEI, then you get this sort of 50-50 split, right? But when you talk about what it is, you get wide agreement.
It restores a lot of faith in humanity and universal
Yeah.
things that we find good regardless of background.
Yeah. And then they're powerful people actively trying to create misunderstanding and division and trying to create divisiveness. We have to be able to understand what's going on as a collective and to find that agreement just as people and connection and not be swayed by the manipulations.
And it always comes back to education as power, which is why it's so important to understand all this that you guys have been able to write about.
Yeah, thank you. It is about education and it has to be done really thoughtfully and carefully. These are sensitive, important topics. And so we feel really strongly in the work that we do at my company that we're bringing people in. This is not about blaming and shaming people. It's not about creating division. It's the opposite. It's about creating community and trust and connection and building a deep understanding in the way people can really see what's going on. And that creates resistance to the manipulations. When you really understand what's going on, then you're not as swayed by sound bites from the media.
The other piece I really loved from your book was the message of how you expect subtle acts of exclusion to happen and how it's just part of being human and how we all make them. And usually they're
Yeah.
unintentional. And as
Yeah.
part of the framework is to just be that receptive to feedback and have that humility.
Yeah, absolutely. And that I hope for people, and I've seen it happen, so I know it's the case. It relaxes people. You can breathe. You don't have to feel like you're walking on eggshells. And there's some examples that we show. One of the most impactful things I do is I went around with a videographer on the street and just asked people, what are some subtle things that happen to you at work? And other people wouldn't even realize that would make you feel bad. And so I have these 10, 15-second clips where I can show audiences examples of that. There's one which is such a light bulb for people all the time, which is a man who's blind talking about when he walks down the hallway at work and people silently flatten themselves up against the wall to get out of his way. And he says, look, I know you're trying to be helpful, and yet it makes me feel not normal and like a burden. And if you just said hi, that's what I would need to get down the hall. And then maybe I could talk to you or ask you a question. We could bond a little bit. When people hear that, they just go, oh, of course, that makes so much sense. You just don't know because you just can't know everything about what everyone experiences.
And these social interactions too, it's interesting because it's medicine. It's a pillar of lifestyle medicine, the connections, and
Mhm.
how much these social interactions are needed and how much they're decreasing just with all the technology we're in. It's so wonderful to be able to hear. And these clips sound really insightful because it's part of
Yeah.
education now that may not be so commonplace.
Right. And they're real. And that's part of my philosophy on educating people. I bet lots of folks who are listening have done e learning programs, maybe where you've got like actors doing a scenario. And that always, to me, feels like it raises your antenna. Is this even real? This feels fake and exaggerated. And so the realness of it really matters for me. It's real people talking about what they really experienced, not actors or stock photos. I think how you do the education matters.
So for the book, again, I was so excited because the example there of the organizational work of this was the Tufts and written by the one who was in charge of it. It was during COVID time, which was also such a trying time for everyone.
Mhm.
And the realness of being able to do that in a large academic medical center, I was wondering if you would be able to share how your experience was being able to affect that, facilitate that type of change in terms of successes and challenges that you might have faced.
Yeah, that was amazing. Gosh, it's interesting you say that because I forgot, it was just coming out of COVID. Lots of different lessons, right? One that sticks out to me is the framing of it all, right? So, one of the first talks they did there, they said, we need you to come talk to our nursing leadership and our nurses. So, just coming and speaking to nurses right after COVID and just starting out the whole thing by saying, my gosh, like what you all have been through, the work that you're doing. This is not supposed to be an extra burden, telling you you're doing something wrong, making you feel bad. No, this is just hopefully shining a light on a different way that we could all be more inclusive with one another and do that work even better. It's supposed to make you feel good to be part of this and not shamed. It's making me tear up just thinking about it because there were a lot of tears in that moment. So that was part of it. Just the coming out of COVID piece. Then there's also how do you scale this and how do you make it so that, like for nurses, for example, on the front lines, you can't necessarily take an hour out of your work day to attend a training. So, how are we going to bring the strategies, the understanding to people in a way that works for the work they're doing? One of the ways we did that is bringing together a group of people from every part of the Tufts Medicine organization. People who work in administration, in food service, people who work in nursing or physicians, interpretation services, just everything, bringing all those people together and doing a very intensive sort of just starting with 2-day training, basically building up their capacity to be able to go out and share this with their departments, with their teams, realizing that was going to be way more effective than having us try to schedule something with them. So that was the start of it. And then check ins over Zoom and continued coaching and sharing experiences, all of that was really critical. Getting leadership buy in from the very start is another lesson. Meeting with the CEO and the top leaders at that organization to really help them understand why this is so important and get buy in to build it into the ways that they're addressing this at the organization. I'm sure people listening know there's a big difference between a leader who gives support in a half hearted way and a leader who really gets it and gives real support to an initiative. It makes a big difference for the culture because people get so good at reading their leaders and reading behind the words, what are they really saying? So when they really mean it, it makes a big difference. So all of that played into how we approached that work.
You had mentioned the tears that came when you when you were remembering that work. I also just reading that, and there was a quote that I had from your book that when I read it, I told Doc Jana too that it brought me to tears because it was like I didn't
Mm.
know even it was, you guys had written organizational leaders have a responsibility to keep people safe from psychological harm in the workplace. And that employees have a legal right to work in a place free from harassment, including the hostility associated with an environment saturated with unaddressed subtle acts of exclusion. I just couldn't even imagine what that would be or how that would have changed training as a physician. And so the fact that somebody wrote about it, even though I read about it many years later, it just brought so much peace.
That makes me happy to hear that. And it seems like it should be so obvious. And yet, for so many people, like you're saying, that is not the experience.
Not at all. And despite the data, despite the fact that it results in burnout, medication errors, people leaving. And
Right.
you had talked
Right.
about the great resignation in 2021.
Right. And it's still, I mean, even after COVID, even with all the return to work stuff, there are articles written about this. Like Black women don't want to come back to the office to that culture that you think is so great, right? It's not just that it's more convenient to be at home. You don't have to be in that culture where you're experiencing these exclusions. You think your culture is amazing, and why wouldn't everyone want to come in to be a part of it? And it isn't experienced equally amazing for everyone.
That's such a point I never even realized, like, why do you feel better? Every time I used to think about going back at the beginning when you transition careers, it's always like, "Did I do the right thing? Why do I just feel so much better now when I'm not there despite all the good
Right.
work that you do?"
Right, right. Oh,
Yeah, and so I wanted to ask because we had talked so much already, you touched on organizational health, well-being, culture shifts. Lastly, I wanted to ask you, so for coaches, regardless of niche, whether they're health and wellness coaching, executive coaching, either you get the privilege of coaching someone in that C-suite leadership position or coaching someone who's more frontline. How can they be empowered to make a difference regardless of who they're coaching by learning more about the subtle acts of exclusion and helping to share that with whoever that they're guiding through?
yeah, great question. So, just understanding more first. And if you are a person who gets that from reading a book, great, it's there. If you're a person that needs more engagement, interaction, we have like self paced e learning tools that aren't those boring ones that you hate, but that are ones that have those real video clips where you can see real people and interact. That's talking about how we take that learning seriously. Like when I designed that e-learning course, I worked with one of the earliest members of the company Leapfrog to design it because the idea is they know you have to keep kids' attention if you want them to learn something, and adults aren't that different. So you have to keep people's attention, especially in today's media environment. So that's another way to build that deeper understanding. So building that all up, maybe even getting coaching yourself, just like really building that understanding in yourself and then being able to share that with the people that you're coaching. And obviously, people go to coaches for a wide variety of reasons. Some of the people we end up coaching are because they're being mandated to go see coaching because they've been the ones to initiate subtle acts of exclusion. And so then it's really helpful to be able to help them see why this is such a problem, how this landed for people, relatively simple steps you could do to be more empathetic and understanding and listening when people share that with you rather than being defensive. So it's really helpful in those cases and helpful for leaders who probably want to be an inclusive leader, but maybe don't quite know what that means and don't quite see the importance of responding to these things. Like we'll often work with leaders and they'll talk about a subtle act of exclusion that happened in a team meeting and they'll say, yeah, I didn't know how to respond to it. And we'll say, what did you do? After the meeting, I went to talk to the person that said it. And then I went privately to talk to the person that I think it was directed towards. Okay, those aren't horrible impulses, but what about everyone else who is that at that meeting? What message did they get about how inclusion matters on this team and how inclusive a leader you are and how you know how to handle those situations confidently? Even if that's just saying, and this is a strategy we often coach leaders on, even if it's just saying, hey, something just happened. I don't know how to respond to it right now. That's making me feel something, but I don't even know what yet. But I will find a way for us to come back together and address it. Now is not the time. We got 5 minutes left in this meeting, but I'll figure it out. And that vulnerability and being able to admit when you don't know something not only is really powerful as a leader, but also it makes it so that you can actually figure out what to say because it's hard to know what to say with these complicated topics. Some other leaders that we work with will say something like, oh, I just use humor to diffuse the situation. And I just want to scream. Like in a split second, when everyone's eyes turn towards you to see how is the leader going to respond here, you think you're going to be able to think of something funny to everyone that conveys also how seriously you take inclusion. Good luck with that. Like, don't try that. Say something else instead. It makes it so much more likely you'll be able to do it if you just say, yeah, I don't even know yet, but I will do it. that really matters. And it's helpful in their development as a leader who creates inclusion on their teams, who creates safety on their teams. Because a lot of times they want to do it and they don't really know how to put it into practice.
Thank you so much. I remember so many examples you both gave in the book of how an individual response versus having an ingrained culture change response, like what you were just sharing. And
Yeah.
I guess with time, it almost makes the saying, I don't know, we'll come back to this later, feel more comfortable because now there's actually a way of dealing with this.
Yeah, exactly. And of course, you have to actually do it or you erode any trust you had built up. So you really have to do it. And sometimes that culture change work is helping everyone realize and systematize how do we deal with different kinds of interactions. Some are really not bad intentions. We could call them subtle acts of exclusion. Our first solution might be for people to talk about it and resolve it and get it from yellow to green. Other times, it's not something I would call a subtle act of exclusion, and it's not something I would call well intentioned. And then we have a different procedure for that. Sometimes it starts off as something maybe in the yellow zone and turns into red because of how that discussion goes. What's our procedure for that? So just getting everyone on the same page with that stuff is really helpful too.
For sure. I think one of my biggest takeaways from speaking with you and reading the book is also how, when you experience these things firsthand, after a while, you have talked about internalized marginalization, how it's just okay, you assume it will happen to you. So all I have to figure out is how I'm going to deal with it and either try to rectify a situation if possible or survive and let it go.
Yeah.
And the National Board for Health and Wellness Coaching updated their competencies for health and wellness coaches, and they included microaggressions. And this really seems so simple, but the effect of it on the whole person, how we see ourselves in society, and the impact of it on health and well being is enormous. I'm so glad they added it. But how I found you was through your book. And so grateful for all the knowledge you've been able to share because even though there's research on it and there's obviously people who've written on it, your book is so widely received and known. So thank you.
Thank you for saying that. Yeah, you write a book and you don't know. It first came out March 10th, 2020. And as the world shut down like March 13th, there was a moment where all the book tour things were canceled. I thought, okay, all right, maybe no one will read this book. We can write another book. But then, of course, especially with the murder of George Floyd that summer, people turned to reading books like this in a whole new way. And so it did have that uptake. And just to see that reaction has been really amazing to be able to make an impact in a sort of scaled way like that.
And the fact that you've also made these insights accessible, like you had mentioned with the e-learning, how much thought and time and effort went into it, and your podcast, The Culture Advantage. It's amazing because we get to have these conversations with you. And
Yay.
and so thank you for sharing all of these resources.
Oh, thank you. Thanks so much, Jessica.
Yeah. And so just to wind up, I'd love to ask, what's your takeaway message for the coaches, healthcare providers listening to this podcast episode?
Great question. It would be like, this really matters and we can do something about it. It's not something we have to be fatalistic about. It's super important and there are solutions.
Well said. Thank you so much.
All right. Thanks, Jessica. Great to talk with you.
Thank you for listening. I appreciate you and value your feedback. So please subscribe and write a constructive review. If you'd like to be informed of new episodes and offerings and resources for coaches, sign up for our email list at www.centerforhealthandwellnesscoaches.com. Sending you warmth and light.